Thank you. Good morning, ladies and gentlemen. Really glad to share the perspective of manufacturer when it comes to FMD. My name is Philippe Drechsle. I'm working for Teva Europe, and I'm in charge of the implementation at European level. So what I'm going to discuss with you is, first of all, I'm going to tell you a little bit what Teva is about. Many of you know what Teva is about, but I want to share some information. I have a short part on the FMD requirements, but I think Stefano and Andreas already mentioned a lot of the points, so I'll try to keep it short. I'll try to explain you the challenges we're having and facing with this project. We'll also try to explain you the timelines and the team that is involved in this project. So, that's the wrong, that's right. Yeah, want to start with a little quiz. Anyone has an idea what this figure stands for? It's not the cost of the implementation, hopefully, luckily. This figure stands for the number of packs of products Teva is selling in Europe on an annual basis. So Teva is selling, year on year it varies, it's between 1.2 and 1.4 billion packs only in Europe, 2,500 packs basically every minute. So the reason I'm showing you this is not to show muscles, and the reason why I'm showing you all of those figures about Teva here is also not about selling you the company and convincing you should buy Teva shares, but it's more to show you the challenges we're having as a big generic manufacturer. So besides the number of packs we are selling, we are operating 15 manufacturing sites in Europe, which have to be upgraded. We have 1,000 molecules. We probably have around 60,000 SKUs in Europe alone that we need somehow to manage and to have it implemented in those SKUs. So that's a quite important challenge that we are facing. And again, as I mentioned, a lot of operations are involved. We have to make sure that all the national organizations, our national affiliates, are also involved and get the project implemented on time. The Falsified Medicine Directive in the EU is only one part of the requirements we have to fulfill as a global company. As you can see, and I think my successor as a speaker will come from Turkey. There are some companies from some countries that have already implemented regulations, and some others are coming. So that's good and bad. I would say it's bad for us as a company because we have to fulfill different requirements which are similar, but not 100% similar. And on the other side, for us in Europe, it's a good thing because we can learn from the experience that we have in other markets. And as we could already see in Europe, it's going to happen in 2019. Countdown had started. Andreas mentioned it's not too much time we're having to implement it, to be honest. So again, not going too much into the details. This is what the directive is requiring. We heard about this, so I'm really not going into the details here. I would like to share some findings when it comes to the tamper proofing, which has not been regulated, which is open. We're looking currently at 3 options, best practices. You can either glue the pack, you can put a sticker on the pack, or you can use a kind of lock-in technology, which is showing once you open the pack, it's been opened actually. All of those technical solutions have pros and cons, and I would say at this stage, none of them has proven to be 100% secure. So we are still in the process of investigating. We have to gain experience as a manufacturer, and suppliers of those solutions have also to find the right solution because it has to fit 100% basically. There is no room for error when implementing those elements. This is again coming onto the requirements. I don't want to go too much into the details. I would say the last point is maybe one thing which is showing the nice and good way how the collaboration was between manufacturers and the regulator. Initially, there wasn't any washout period, so it was considered to be implemented as of January 19th, 2019. And all the products that would not comply with the requirements at that time would have to be recalled and withdrawn from the market, which luckily does not happen. Yeah? So that's also showing the practical approach to this project. Coming into what this means for us as a manufacturer, so one of the challenges we're having is the systems, because one thing is about printing some elements onto the pack, but we also heard that the backbone for the whole system is that the information needs to be tracked. So we heard from Andreas what this means in terms of systems and at different levels. When it comes to us as a manufacturer, we will have a global repository, which is including all the relevant information, and then we will just break it down into the different sites and also ultimately into the different lines. So there are different layers of systems that have to interact with each other also within our own systems. So that's quite complex when it comes to the implementation. And the other complex point is about the third-party manufacturers, our CMOs, that will also have to be integrated to some extent, but I will come back to this a little bit later. So this is the challenge of third-party suppliers. There is a question, of course, of interpretation as well on who should actually be connected to the EU hub. And I'm happy to share some thoughts on this during the 2 days I will be here. Our understanding is that basically Teva, being manufacturer and marketing authorization holder, will have the connection to the EU hub. If we are contract manufacturing some of our products, those contract manufacturers will not have a direct connection to the EU hub, but it will be our responsibility to make sure this connection is working. At this stage, there was also a question about third-party packaging, but I think that's clarified, that if we are sending bulk to a third-party packager, he probably will have to be integrated as well, like a CMO into the systems. But truly putting us onto some challenges. We are also having some discussions with our third-party manufacturers to understand what is their level of understanding of this regulation, and the scope of response is quite wide. So we hear answers, we are fully ready, we are already implementing, and we've heard answers, we don't even really know what it's all about. So it makes us a little bit nervous, because the awareness of this regulation varies really from company to company. And we have to make sure that our partners will also be ready to implement the whole project. So it's also a distribution channel. So we heard a lot about a challenge. We heard already how this should be working. So there is a check-in that happens at manufacturer level, and ultimately the package is being checked out when it goes to the patient with some exemptions when it comes to hospitals. So there are some exemptions, and the wholesalers that have also to do some cross-checkings when it comes to certain channels they get the product from. But definitely we have to make sure this connection will work properly. And again, just to remind you of the number of packs that will run through the whole system, it's a significant amount of data that will go through the system. And then the commercial challenge. I'm happy that Andreas mentioned that the finance is always a big issue here. I don't know if any of you has been in such a situation. I haven't been, I wouldn't like to be, but actually it looks like we as manufacturers would be in the situation of the waiter, and the customers will just leave. We know that besides the system costs that will have to be put in place, so there are one-time costs and there will be a running cost for the IT systems, there are also direct production costs and CapEx costs. We are still in the range of, we're still trying to assess what it means for us as a manufacturer. There are different estimations running currently in the company. We think it's going to be something between 3 cents and 8 cents per pack, just from the manufacturer perspective, not including all the system perspective. So you can imagine that, especially for a generic manufacturer, having quite some challenges from a commercial perspective when it comes to pricing. This is not just peanuts. Yeah? This is a significant part of the product cost as well. So we are fine-tuning and trying to understand what will happen ultimately, who will pay for those costs. Can we charge it back somehow to the patient or to the payers? That's a big question mark. Really not sure about this. So it's really a big challenge for us at this stage as well as a generic manufacturer. Coming to the implementation timelines, so we've heard from Andreas, it's really something that is challenging. It's taking time. We have to equip alone in Europe 100 lines, a significant amount of lines that need to be equipped. The process has already started. The process of the global, so our own repository has already started as well. That's being built currently. And of course, we'll have to work on the connections with the CMOs. We'll have to work with the connections on our own sites, within the sites, and also ultimately the connection to the EU hub. So this will all happen until 2018, and you can see it's really timelines which are tight, and things have to run in a very smooth way. As a consequence, the functions that are involved in this project are really wide. You can find most, the major functions in a pharmaceutical company with some different implications. So we definitely have array that are being involved. One of the big question marks we're having here as well, and it's not yet sorted out, is how will the changes be managed from a regulatory perspective? Will those be variations, which would be a kind of worst case for us, because if we have to file variations on, say, 20,000 M8 we're having in Europe, this is an awful burden, so we're trying to discuss this also with authorities, but the final word will be with the national authorities, so we have to make sure they do understand the consequences and that we can implement those changes just without any major notification. That's what we're working for. We are involving, of course, also QA, because the processes have to be adapted. The artwork needs to be adjusted, obviously. We are working with the third-party contracting group within Teva. We are having discussions with the business partners, with the wholesalers. That's also something that needs to be considered. The logistical part, which, as I mentioned, is somehow a little bit getting out of the focus because there is a washout period, so we can keep the products on the market. And obviously also from a commercial perspective, we need to understand the consequences. So this is a multidisciplinary team that is working on this project that has started some time ago, but it's getting now really in the hot phase to make those things happen. So as a way of concluding, the FMD regulation represents a significant challenge for us despite the fact that we are big and we can afford to dedicate time and resources to it. It's a challenge because we have that many products, we have a huge portfolio, we have big volumes. That might be different for some other players which are a bit smaller, but it's a massive impact for us. Many production lines that need to be equipped. We have all the major functions that need to be involved. We have third parties that need to be integrated. So it's really something which keeps you busy. And as Andreas also mentioned in his speech, it's time to start now, because if you haven't started yet, it will get really challenging from a timeline perspective. So thanks a lot for your attention, and I'm open for questions.
Thank you so much, Philippe, for showing what it really means to implement for a big manufacturer. Are there questions in the room for Philippe? Can we get
Hello, I'm Robert Moss. I'm probably in a lion's den here, but I'm always very interested about who's paying for these costs. If you look at a general picture, it's very interesting that you say maybe ultimately the patient will have to pay. Isn't it always the fact that ultimately a health system will have to pay? Or is it really that you're going to put down your profits as at pharmaceutical companies. So it's more or less, well, are you really willing to say, okay, this is it, and we're not going to charge it to finally the health systems?
So it's a bit of a tricky question. Let's put it this way. Of course, the whole project is about patient safety in the end. That's the target. And of course, in all fairness, the patient should also be the one who pays for it because he's benefiting, or at least the payer. What we also do know is that depending on the systems that are in place when it comes to pricing and reimbursement, there won't be any room for charging this to the patient. So it's going to be discussions we will need to lead in the different markets to understand how it could be charged back. What we know at this stage is we don't have any choice anyhow. We have to do it. So let's start to do it. And let's try to have a fruitful discussion afterwards with payers, insurance, and so on and so forth. But it's something which we haven't addressed at this stage because we also need to understand in a very detailed way what will be the impact on the cost per unit, which is something which is still grey, to be honest. But I would say the range is open, yeah, from the manufacturer will have to absorb it somehow to it can be fully charged to the patient or to the payer. I think the options will be really multiple here.
Thank you very much. Any other questions? Yeah. Coming here in a second.
It's sharp.
No, I prefer micro release that everybody. Hallo, kein Mann.
You had your fitness already. Maybe related to it, but I'm also thinking we're talking about cost, but in the end, you have a significant loss of sale because of all this falsification, and so I assume there's also a saving of potential sales that you never made because now it's going somewhere else, and that won't be possible anymore.
Yeah, it's a good point. Actually, it's always difficult to assess the impact of some counterfeit medicines. I think when it comes to us as a generic manufacturer, and I think this is also one point which is mentioned in the regulation, the major target has always been towards the originator's product. So and for some very specific products, it can be massive. The impact can be massive. For us at Teva, it never used to be like a huge, especially when it comes to the generic part of the business. It was never like considered being like a huge impact. But in the end, it's something we have to do, and it has been mentioned several times. It's a good thing to be done. So there is no debate about this. Yeah. And
related to that, the systems that will give you like a full visibility on what's happening, where and how. Because I assume you send the data to the hub, but in one way you will keep also the data which today might be spread over in all kinds of Excels and whatever systems. You would have a better visibility on things. Is that not producing any benefits either?
I don't think we would benefit. The internal data we are using currently is set in a way that it's already usable for us, and we can make the most out of it. So we are adding an additional layer onto our systems. We'll see if we can get some benefits out of it. But we have already systems in place which give us visibility. And of course, one of the drawback is, and this is coming back to the data sensitivity. The question was raised earlier. Can we as manufacturer also have an information on how many packs are impacted by those problems? So we'll know because we get a notification. Hey, we heard about this pack, or we've received notification that this pack seems not to be okay. But it will be very ad hoc, and we'll get it just as it comes. But we won't get any additional data out of it because of the data protection principle.
Let's say I'm a hospital pharmacy and I don't have connectivity today. Can I pick up the phone and talk to somebody to authenticate? Somebody needs some medication in OR right away. What happens? Can I pick up the phone and talk to a manufacturer is what I'm asking.
No, I think this is not the scope of the regulation here. I think the scope of the regulation is to say that you really keep track of the medicine. So if you are a hospital pharmacy, you would ultimately go to your distributor, to your wholesaler, and you will buy the pack from him. What the regulation though is saying is that under specific circumstances, if you are buying the product, normally the checkout, the decommission of the pack should be done once it goes to the patient. In your specific case, it's not going to the patient because you will have all your internal systems, and this is where there is a kind of specific system where the checkout will probably happen earlier. So the product will be checked out earlier. It will go into the hospital pharmacy, and it will be considered as being out of the system.
So authentication happens before dispensation,
Yeah.
is what you just said.
Yeah.
Okay.
Thank you very much, Philippe.
Thank
for
you.